sure we're going to get a build-up of the audience as the day goes on, but I'd like to extend a very warm welcome to everyone to Singapore, and in particular this conference here at Marina Bay Sands. Yesterday, I just looked at the agenda. Yesterday, I think we had some pretty stimulating discussion. I think it's fair to say if one looks at clinical development in Asia today, it's no longer a nice to have as part of a global development program. It's a must have because of the commercial importance of some of the larger markets in Asia. And so having been in Asia over the last 7 years or so, I personally and the organization, I think the industry, has seen a complete scene change over the last 7 years with this shift in mindset from Asia being a nice to have in global clinical development to Asia being a must have in global clinical development. Now, alongside that, there's also been a shift in prioritization in terms of where CROs, where customers, where organizations that are involved in clinical research, how they prioritize their own operations in Asia. And perhaps most interestingly for me, it's the innovation that's coming out of the region, be it innovation in China, be it innovation in Korea, or indeed here in Singapore. And I'm not talking purely about scientific innovation, I'm talking about process innovation as it pertains to clinical development. So on that note, truly look forward to today's sessions, which I think is going to focus more on project management and innovation within that area, data management, biostatistics, feasibility, site ID. We're going to be looking at some specific geographies like Indonesia and Korea, as well as Japan. So it's going to be a pretty interesting day. It's a pretty packed schedule, and myself as chairperson, I think prime responsibility is to make sure we all stick to time. So for those of you who are speaking, I will give you a 5-minute warning just before your session comes to an end. Before we launch into the first introduction in the first session, I do have a couple of slides which I hope would set the scene for us here in Asia. This is an interesting slide. Saw it presented at a conference in Hainan in China in December. This professor of economics, Angus Maddison, has looked at world economic history. And so this chart basically charts GDP starting the year Christ was born to today. So it's a 2,000-year history of world GDP. And the interesting point about this is for 1,800 of those years, if you look at that, 60% of total global GDP lay between India, China, and the rest of Asia. 60% of total global GDP for a 1,800-year period. That shifted around 1800 with the onset of the Industrial Revolution, and it shifted to the west, and we're seeing a gradual shift to the east once again. But it's the first time I'd seen it presented that way, and I thought it'd be pretty interesting to show this slide to the group. This next slide comes from IMS. Now, you probably do remember Goldman Sachs coined the term BRIC Economies, Brazil, Russia, India, and China, as being the fast emerging economies of the world. IMS, from a pharmaceutical perspective, called them the farm emerging economies. And the other interesting point here is you can see the Asian countries play a rather prominent role there. China being the fastest growing in Tier 1, India is there in Tier 2, and very interesting, Indonesia, Thailand, Vietnam, and Pakistan are in Tier 3 as farm emerging economies. And this is on a global scale. So the fact that we've got a presentation today about Indonesia, the fact that companies today are doing pharmaceutical development activity in Vietnam, as well as to a lesser extent in Pakistan, does speak to this quite nicely. And finally, to set the scene for the day, our good friend Einstein, the significant problems we face today cannot be solved at the same level of thinking we were at when we created them. So it's all about thinking differently. It's all about taking a different perspective. And hopefully, our speakers today will take a different perspective as we talk about Asia.